Afternoon. I'm Laura Enomoto. I'm one of the surgical oncologists at the University of Tennessee. As a surgical oncologist, I see a broad range of cancers, but one of my specialties is melanoma. With the sunny weather coming up and with it being Melanoma May, I really wanted to talk about good UV protection and how to prevent melanomas. Unfortunately, melanoma is the deadliest skin cancer, and it affects a very young population. So oftentimes less than 50, and is the most common type of skin cancer diagnosed in those between 25 and 29. It's also relatively common. About 1 in 50 people will be affected throughout their lifetime by melanoma. Oftentimes it can be difficult to figure out which lesions or which skin spots are melanoma. A stands for asymmetric. So most melanomas will have one side not be equal to the other side. Similarly, the B is for border. A lot of times on melanomas, we see an irregular or almost scalloped-like border on the melanoma itself, and that is more concerning than something that is a more well-rounded kind of shape. C stands for color. I think a lot of people think about melanoma as just a black spot, but most of the time when I see melanoma, it has multiple different colors within it, blues, browns, and blacks. And so if you see a spot on your skin like that, that would be more concerning. The D stands for diameter, and so most melanomas are diagnosed when they're a little bit greater than 6 millimeters or the size of a pencil eraser. Now that doesn't necessarily mean that something concerning can't be less than 6 millimeters in diameter, but anything that's going to be more than that should probably be looked at. Last is evolution, or E, and so that is really referencing how the melanoma may change over time. I hear a lot of patients say, well, I've had this mole for years, but in the last few weeks or months, I've noticed it getting bigger or changing color, or oftentimes saying, well, it started to itch or bleed. And so that is a more concerning type of lesion. One of the best ways to treat melanoma is really to just take care of it early. The earlier you can find it, the better off you're going to be. And also just to prevent developing melanoma to begin with. You know that melanoma is often started because of UV radiation, and so really, avoiding sun exposure is going to be the best way to prevent melanoma. So if you're going to be outside, try not to be outdoors in the UV rays between 10 and 2 when the sun is going to be the hottest, or if you are, try and be in a shady area. If you do have to be outside, try and wear good sun protection, so UV blocking shirts or wide-brimmed hats. Last, if all of those fail, at least be wearing sunscreen with an SPF greater than 30. And if doing a lot of water sports in the pool, in the lake kind of thing, making sure to reapply that sunscreen at least every 2 hours. So hopefully this gives a little bit of insight into melanoma and kind of ways to prevent this. So.
Thank you, Doctor. One question from our audience about, you had mentioned, I guess the earlier or younger ages, you actually see that. Is there any difference or suggestions you have for men versus women, or is this pretty universal?
It's pretty universal, although it is a little bit more common to be seen in men. Okay. I guess one of the other things I didn't mention is tanning bed use. And tanning bed use can actually raise your risk of melanoma by 20%. Even one time in a tanning bed. So avoiding tanning beds at all costs for men or women both.
Great. And then if somebody does, maybe they're watching and they have noticed something change or just are concerned, what recommendations can you have or do you have?
Yeah, so luckily in Knoxville we have a lot of great dermatologists. So maybe starting out with a PCP or going to, if you already have a dermatologist, making an appointment and having that checked out right away.
Wonderful. Thank you for your time.